Hello, ladies and gentlemen, and welcome. We will be starting at about the minute after mark to ensure we capture our full audience. So please hang tight for the next 60 seconds, and we will begin today's webinar shortly. Alrighty, thank you for attending today's webinar, Accelerating Innovation for Better Patient Outcomes with Insight and Dell Technologies. Before we begin, there's just a few housekeeping items I would like to cover very quickly. At the bottom of your screen, you'll notice a handful of widgets, namely the Q&A widget, which you can utilize to submit any questions during today's webinar session. Our team will respond directly to the questions via the chat box throughout today's webinar. In addition to that, our speaker will be asking a series of poll questions. We encourage each and every one of you to participate. For viewing purposes, you can expand your viewing window by clicking on the icon found on the top right corner of the slide viewer. If you have any technical difficulties at all throughout today's presentation, please click on the Help widget. I wanted to begin our session today providing some insight into who we are as an enterprise. Today, technology isn't just supporting the business, it's becoming the business. At Insight, we define, architect, implement, and manage Insight intelligent technology solutions that help organizations of all sizes run smarter. As a Fortune 500 ranked global provider of digital innovation, cloud and data center transformation, connected workforce, and supply chain optimization solution and services, we help clients navigate complex IT challenges to develop fresh outcomes and processes. Our offerings combined with our expertise in modernized applications keep businesses running, foster flexible work environments, and put you at the forefront of innovation. From IT strategy and design to implementation and management, our 11,000 teammates are committed to providing the technology, solutions, services, and support to help your business run smarter. And with that, I'll turn it over to your main presenter for today, Dell's Robin Braun. Thank you and enjoy.
Thank you so much for having me on today. Delighted and excited to talk with all of the folks on the webinar, and appreciate the time with Insight to be able to talk about healthcare and Dell and Insight and Dell. So we're going to first start off with a quick poll just to kind of get people warmed up and engaged. And it's an easy one, just a yes, no. If you can just fill in, are you currently using any Dell Technologies products? So just a quick update. We'll get that, get your feedback there, and we'll give you just a few seconds to click on it. Sometimes it takes a moment to be able to get the results tallied. And there, great feedback. Thank you to those 66.7% who currently are using Dell products. We appreciate your support and being customers. So what we want to talk about today, and you may be familiar with Dell Technologies overall, but you may not be as familiar with us and what we do in healthcare. And so a number of things we're going to talk about today are focused on healthcare. Of course, a number of the technologies can also be used more broadly as well. But it really starts from the top down with Michael Dell. And with such a compelling quote that by 2030, we believe we'll be able to transform the lives of 1 billion people. And healthcare is one of the most important areas where technology can have an enormous impact. Well, I know you could read that. I like to read it out loud because it has such an impact on how he approaches supporting healthcare, both from a support perspective from its foundation, but also internally in how we look at supporting our healthcare customers. And he's the only one of his siblings that isn't actually in the medical field. I'm sure that his mother's gotten over that disappointment by now. But we're very proud and humbled to be able to take on these type of audacious goals and look at how we not only provide the infrastructure, but we provide the infrastructure that can help change lives and help change access to care. So some little tidbits you may not know about Dell's presence in healthcare is that we have over 10,000 worldwide hospitals using some form of Dell Technologies infrastructure. 67% of all of the storage is on Dell infrastructure, with closely followed by client, with 62% and servers being around 50%. And then, of course, with VMware, that 93% of the U.S. hospitals are also virtualized by VMware. We're very humbled by these numbers because it shows the level of trust that our customers put into Dell Technologies infrastructure across the board in being able to run their critical applications and environments within the healthcare environment partnered with Dell. And we do view it as a partnership in how we support our customers and help them support their inpatients. But there are also a number of trends that are happening in healthcare that we'll talk about here just very quickly, none of which should be a surprise for those who are in healthcare, around that we have an aging population. No offense to anybody 65 years or older, but that our population is overall aging. But also with that, we see 1 in 3 adults suffer from 2 or more chronic conditions. Now, whether that is because now we can better detect those chronic conditions and because people live longer and we have an aging population, which is when you tend to get more chronic conditions as you get older, all of it plays together to say that more healthcare is needed, more testing will be needed, more support will be needed of the people who are there. Then, additionally, but it's also troubling when you see the amount of time that physicians spend on EHR administration versus time spent with patients, and that there's so much of the time spent entering text, entering the information, sometimes with their back turned to the patient, but it's also an impact on physician burnout and clinician burnout to be able to support this continued growing demand for healthcare. You also see the explosion in telehealth, which many of us have experienced this year in particular, when so much is being done remotely. And then also the 73 days for the amount of medical data to double is just kind of a crazy number, but it starts to put into perspective how quickly the data growth is occurring in healthcare as more tests are needed, as more activities occur. How does that actually start to impact those who are supporting the environment and how to best manage that? And then, of course, whether it's a private, a public, a hybrid, a multi, there's all sorts of approaches to cloud computing, and we only see that cloud operating model is really critical to our customers, whether it's on-premise or not on-premise, that they're able to operate in more of that type of environment. This is just a quick touch to kind of further explain, look at in more of a tangible way that as we have those chronic conditions, as we have that growth, what does that mean? And being able to and shows why we're seeing the type of data growth that we were just highlighting. As we're looking at all the different tests that come up, particularly as you look at the additional chronic conditions that are highlighted there with cancer or cardiovascular disease. And so from a Dell Technologies perspective, we have a focus on essentially 4 pillars, which will help kind of explain some of the discussion a little bit more. Where you'll typically think of us being focused is on modernizing the technology. Again, what I had touched on with the multi-cloud approach, how do we help with a cloud operating model? How do we look at that IT infrastructure consolidation, understanding patterns, being able to consolidate and simplify, and then being able to, and we have special focus with both technical and partner account managers focusing on those high-value workloads in healthcare around EMR as well as medical imaging, with all of your favorite ones from Epic and Cerner and Meditech to Fuji and GE and AGFA, where we work with them to understand their application requirements and be able to map that to the optimal infrastructure that our customers will need by understanding those applications not only today, but where they're trying to go in the future. Other areas where we have a lot of focus is on the connected workforce and virtual health, as well as personalized health. We see a significant growth, as not surprised, in the digital workplace, understanding how to deal with being more remote, being more distributed, how to do that safely and securely. The level of ransomware in healthcare has been staggering over this last year. Additionally, virtual health and being able to do things more remotely, whether it's monitoring, whether it's your doctor's visit, whether it's being able to treat people with chronic conditions or monitor them at home rather than having them to come in more often for checkups. There's a lot of areas where working with our partners, we're able to bring a complete solution to bear to be able to start to answer these needs. And then as we look at the personalized health, being able to look at the precision diagnostics, there's so much happening with AI and ML, whether it's from imaging to computer vision to drive efficiency, and being able to bring those types of solutions into the clinical workplace, as well as, of course, more advanced with genomics and digital paths. So there's a lot of areas where you may not have traditionally thought of Dell and Insight, but where we're glad to have discussions and look at how we can help you and your environment modernize and grow and take on the new challenges that are driven from what's happening around us as things continue to transform. So just a quick shout out to a number of our healthcare partners from a technology perspective. What this really shows is in the power of Dell, and why I get so excited in talking with customers from Dell, is that we can bring together that entire solution, working with fantastic partners across the board to be able to make sure that for our customers, we're bringing the right technology and infrastructure and approach to the table. But what we're going to talk about now is moving into kind of what is data capital. And we started looking at how to transform and how to talk about storage. But I always look at that you have to understand the data. And so what is data capital? And it's a notion or thought that the most important asset that many of our environments have today, or many of our organizations have, is actually the data that they have, whether that be that it could be monetized from a research or leveraged from a research perspective, whether it's being able to drive a more personalized care path approach, whether that's driving up patient and clinician satisfaction. The data that's locked within all of the different silos in our data center is actually one of the most important assets that organizations have today, as well as what has traditionally been considered assets from human capital, intellectual property, the infrastructure that they are in, or their operations. And that's a really important consideration as we look at how we help all of you continue to transform. Is what are you trying to do with your data, and how does that change over time? And I love this. This is one of my most favorite conversations to get to have with customers and be able to drill down, is the value of your data over time. And that particularly in healthcare, you have data that you need to make instant decisions on, millisecond decisions, second decisions, where the information is critical that it comes back and is and is understood by the clinician or clinician team that is working with a patient. But what's important is also how to use that over time, whether that's for that individual patient or for an overarching trend or population health perspective, and to be able to start to understand the value of data over time, not just in the immediacy, but to look at how are you going to use data in the fast data as well as big data, and I always think that there's not only an arrow going from fast data to big data, but also back from big data back to fast data, so that you start to create an overarching improvement cycle, and by breaking down those silos. Again, this is why we get so passionate when we're talking about what storage, what infrastructure, is how do we help you achieve this, so that over time you can start to unlock the value of the data capital that is available to you from your infrastructure. So there's so much happening in healthcare. I just wanted to touch on a number of areas that we see as up and coming, and that we see coming into impacting what has been kind of the traditional. You have an EHR, you have a PACS, and you have your back office applications. You now are seeing a much greater emphasis on AR/VR. Of course, we touched on the telehealth. That's a no-brainer this year. No explanation needed. But then also being able to look at not only what does healthcare mean, but what does wellness mean? And by starting to look at that, and how do we not only treat sick, but also encourage well? And that typically is also a more cost-effective way and better way to help people have a better experience and better quality of life. The Internet of Things is certainly exploding on all fronts across all industries. What can you do with smart sensors, not only from the patient, but at the bed? What can you do with, we work with a fantastic partner around being able to leverage computer vision in a clinical environment to enhance productivity, from a clinic to an OR, to also telemonitoring, and being able to enable nurses and patients to communicate effectively without having to don PPE 6 times an hour to go in and see them. Being able to start to look at then how does some of that information feed back into the supply chain. If you can see what was used during a surgery, you don't need somebody to go manually update a system. AIML, when you look at the annual growth of that over the next several years, it's just staggering. There's in the next 6 years, it's expected in healthcare alone to contribute $8 trillion of additional market value or additional spend. And it's just amazing the entire breadth that goes across, whether that's from what you can think of as very cutting edge with the robotics and all of those pieces, but also how do we really use it to not replace people, but to be able to help people be more efficient and productive and take off some of the manual work that comes their way. How do you help a radiologist better arrange their time, or better prioritize the cases they use? How can you leverage natural language processing to maybe reduce the time the doctor is inputting notes, and instead be able to take in the conversation as they round, so that they can reduce that 2x time they're hanging out in the EHR clicking on a keyboard? So there's so much happening there. And then, of course, again, going back to that value of the data, what does that big data mean? How can you start to break down those analytics, whether it's real time or predictive, and be able to look at across the board, whether you're hitting particular quality metrics or you're looking at business intelligence? It's really impactful how data moves all of that. Of course, as a note, and I just threw this in here because I feel like it's almost silly to bring up that, of course, the way we work has changed. The workforce is evolving, and work happens anytime, anywhere. The reason I bring that up is also because that means that we need to reconsider how do we power people to work remotely and effectively. When they're working from home as their primary as opposed to in an office, what does that start to mean for the bandwidth they need? What does it start to mean for the screens they need? What does it start to mean for the type of communication that they have and the way that you secure it all? Because all of a sudden you have all of these endpoints that are even more exposed than they've ever been before. But it's not just about working from home. It really is about how does it happen anywhere, because even in clinical environments, that flexibility of being able to work from anywhere and in any way has really increased. And with that, and I think that it's important to note that the flip side of that is what is happening with the threat landscape, which isn't, of course, just because people are working from home, but it's because you have a number of it goes to that you have a number of nefarious people out there who, when you think about what's happening, the rise of attacks on healthcare has been, I believe, eightfold this year, and which I think is particularly horrible given the times that we're in, or horrible on any day, but particularly during the times we're in. And but you see the type of information that we have around, 83% of the data breaches in healthcare are financially motivated. That's really frightening as you start to think about the impacts that those type of attacks can have on the care that's being delivered, and the critical care that's being delivered within a clinical environment. So why is healthcare so vulnerable to cyber threats? We're having to adopt technology much faster than we have in the past. We're also having to be more remote than we've ever been. We need to make sure, again, going back to a lot of our areas of focus, how do we modernize? How do we consolidate? How do we simplify the management environment so that you can keep up with patching, so that you can really understand that data flow and be able to help secure it and contain it. You're never going to be able to fully stop everything that somebody is going to throw at an environment, but how do you contain it? How do you fast detect it and contain it? And that's really where the focus is. Isn't just stopping the intrusion, but also being able to contain the impact that it can have once it may happen. And I think that right now, seeing that healthcare is the most hacked vertical we're seeing right now, and what makes this industry different is that it affects everyone, not just financially, but personally. Because if it's your family member or yourself who are in the hospital bed and they've just wiped out your electronic health record, now they no longer know what drugs you may have a conflict with or may have an allergy to. They may not know they may not necessarily know what dosage you need or when you've had your last update. It can be truly frightening for those systems who have gone through that. So just really quickly, just kind of similar on the kind of the scale and the growth that we've seen in these type of attacks and the impact it's having on the healthcare industry in general. Just really quickly want to touch on for those who worry about these types of things. One of the things that we do talk to our customers about a great deal is on being able to look at cyber recovery and having an air-gap third copy of critical data. And that not only being maybe a copy of cache if you're using Epic or I guess Iris now, or something like that, but also looking at your Active Directory. We have an extensive team who can work with you to look at what are the ways that not only do you have critical data there, but also that you have data that allows you to jumpstart getting yourself back online and access back to systems as quickly as possible. Because typically in an attack, they go and they take out your backups first. This allows you to have an air-gap, vaulted backup running the ability to go through and detect differences and changes. There's a great deal of intelligence and built into this, but it's something that if you haven't had that type of cyber recovery discussion, I would urge that you look at it or consider what it could mean for your organization, simply because of the threat healthcare is under. And whether it's with Dell or someone else, having a strategy there is really important, not just for DR, not just to have backups, not just to replicate, but to really make sure that you have that data in a place or in a way where ransomware or those nefarious people can't get at it and can't completely hold you hostage. So this kind of goes into that broader view of how do things work together, and this is a simplified version of one of our customers' environments, and being able to, of course, it's genericized for the purposes of being able to show today, but being able to show that you have the production site, you can have a colo, a DR site, you can also have that third copy at a remote site. What makes sense for you, but making sure that you have all of those steps, all of those layers of protection built in, automated. You see that connection out to the cloud as needed through VMware, and being able to leverage VxRail to make that a very seamless handoff. And again, being able to also leverage Isilon, now PowerScale, for doing imaging and looking at that entire ability to simplify your environment and be able to work with Dell Technologies and Insight to be able to bring that simplification to your environment, and how are you going to manage it, automate it, update it, and continue to protect it as you move forward. So now we have another fun quiz, and appreciate your feedback again. As we go into a little bit more about product, hopefully the background has been helpful in teeing up where we focus with our storage products. So just giving you a moment to be able to input the information where you may be familiar with different topics, and we'll move over. And people know PowerStore and PowerMax, fantastic. And we will introduce you to PowerScale. There, if you're familiar with Isilon and may not have heard the new name, then so that number may have been different if we had put a slash with Isilon there. But delighted to see the familiarity with PowerStore and PowerMax, and we'll touch on each of those as we move forward here. So PowerStore is a product we're very, very excited about. Very much a modern developed product with being able to have containerized services to be able to deliver the different storage functionality that you require and need. It's a great workhorse. Looking at it from a data-centric perspective, having both block and file, being able to have a great deal of intelligence as well as being fully adaptable, having that type of data reduction that you require from NVMe, but also the flexibility to be able to understand the data and make sure that performance is balanced, and incredibly easy integration and automation. I hate when they put automations in there and I forget it. So it's just a really quick touch on it, that you can have the apps and databases, you can have containers, you can have file, all across the board, looking at both traditional and modern workloads, being able to consolidate, starting with a 2U form factor. What we've seen and are really excited about, particularly in healthcare, is that you can look at it from an EHR perspective, even part of an imaging solution, but also we have a fantastic partner we work with, Medical Informatics, where they take in analytics from the bedside and are able to use the new version, or the version that PowerStore has, where it allows you to run compute and storage on the same platform. So in a 2U environment, you can run the collection of all of the bedside monitoring, which normally is just dropped on the floor and not captured. You're able to take in all of that so that you can graph it over time, have much greater insights into your patients, and be able to feed that back to Epic or another EHR as well. So terrific power, terrific consolidation. We're very excited for what PowerStore brings with the flexibility and being able to drive it across any workload. Touching again on PowerMax, which more of you were a little bit more familiar with, this is our high-end storage. We're very proud of the legacy that what VMAX, now PowerMax, has the kind of the heritage and legacy of being at the high end of storage. We see a great deal. This is primarily focused in block storage and around EHR as well as ERP and other critical applications where you just really can't take any downtime, and that everything can be updated live, both for PowerStore and PowerMax, and being able to have really that trusted platform and be able to scale out with a best-in-class data replication facilities as well, and the non-disruptive upgrade as you go forward. So I just think this is such a great statistic that I always love to show it, is that not only when you think about banks and on Wall Street and those types of areas, but the top 10 healthcare companies worldwide also run PowerMax and VMAX, and really being able to look at, again, what is that TCO for consolidation? How do you ensure that predictable performance? How can you look at that flexibility, but still maintaining the data availability that you need? So again, it goes to looking at and getting the right platform for the type of workloads and the type of data growth that you're expecting. But we're very proud of both of those platforms and how they're able to support really best in class in healthcare. And now we'll touch on, and these are just drive-bys. Absolutely, please reach out if there are any questions or details, but just wanted to give you that taste for the different products today to be able to understand how they fit into healthcare and how they fit into that data growth and data availability and security that you need within the healthcare environment. And then last but certainly not least is PowerScale and its operating system of OneFS, and being able to start small and scale out to a staggering scale all within one file system is really unique in the industry. And this is for unstructured data. We say a great deal of whether it's imaging, even home directories, but also as you start to look out at all of the new workloads and being able to talk about that big data, how do you bring that together in data over time? Frequently Isilon and now PowerScale is the platform of choice. So just quick touches on it is, again, that starting small, but growing out to petabyte scale frequently, quickly, as people look at how to, again, consolidate, reduce the number of different platforms they have in their environment, and be able to simplify their management by leveraging the flexibility that the platform brings. They're able to add new nodes in 60 seconds, decommission old nodes, again, no downtime. And what you're seeing across the portfolio that we're talking about today is really that focus from PowerStore to PowerMax to PowerScale around not having downtime, that is something that you cannot afford in healthcare environments. And how do we architect the solution, not only for from the day-to-day run rate, but how you manage it, how you upgrade it, how you change it over time, so that you're able to ensure that you don't have downtime, because that impacts your environment, it impacts your patients, it impacts all those who are being serviced by that infrastructure. You can also auto balance out and being able to, again, no hotspots. We have similar functionality within PowerStore and PowerMax. Again, how do we help these platforms best service your needs and the applications and workloads, which are different across them, but all require the type of performance that you need. Being able to have that resiliency and efficiency, again, all of us are including data reduction, but also the efficiency that you see with the different ways that the platform is formatted, that we have the best raw to usable ratios out there. And then, of course, embracing when you're ready for DevOps, whether that means you want to embrace that for AI ML, whether you want to look at that for patient applications, regardless of where that is, how do we embrace being able to have different types of development and flexibility within that cloud operating model? And I think this is just a great summary for unstructured data in healthcare, looking at the myriad of use cases, which are really wide and exciting, from digital pathology to trending information, to being able to take in all different types of imaging, including encounter-based imaging, something we've seen a significant rise in this year as handheld CT scans are happening in ERs, and being able to make sure that all of that information is tracked and managed and still maintained as part of that patient record and understanding, so that you have all the different touch points and views. Again, also the video surveillance we see, but not just surveillance or safety and security, but looking at it from a computer vision and productivity standpoint. Again, starting to use AI ML, starting to apply that and taking the ways that we can simplify things for people by leveraging technology to new heights and new levels. Last but not least, we do have an entire Healthcare Power Chat podcast series. You are absolutely free and able to go download and listen to any of those episodes, as well as our healthcare page and our different social links as well, that go and put great information out there, not just specific to Dell, but also industry trends and activities. And we'd love for you to join us and participate with us in our discussions online. So with that, I'll turn it back to Erin, and appreciate everyone's time today from Dell Technologies and Insight.
Great, thank you. I wanted to give a big thank you to our guest speaker, Dell's Global Storage CIO for Healthcare, Robin Braun. And to the attendees, thank you for the time and opportunity to come together today. I encourage you all to provide any feedback you may have by completing our survey. And don't forget, this will enter you in a raffle for the chance to win the latest Xbox. Also, please note the presentation will be available on demand, and the deck itself will be distributed via email post-event. And with that, I'll turn you back to your day. Thank you, everyone.